Hello, my name is Kenneth Bui, and I am presenting with my team Christine Chu, Samantha Nguyen, and Jason Tai. Today, we will be presenting our findings of our research topic on the treatment of depression for American teenagers. Now, take a look at these images. What do you see? To many of us, these images are far too familiar, whether we've seen them in a lecture or can personally relate to them. These are the stakeholders of this topic at hand, as well as our team question, which I will get to. Of course, there are various other stakeholders such as parents, doctors, etc. However, my team has agreed that the most important stakeholder is the victim themselves, and the American teenager growing into adulthood and having this development be impeded. Now, why is this important? This here is a graph by the CDC, that is the Centers for Disease Control and Prevention from 2020, detailing the proportion of American youth who have been diagnosed with various mental ailments. Let's stay on course of our topic and focus on the depression side, specifically the 12 to 17 range. These numbers are staggering and they're only getting worse. On the report that we've linked to, the CDC says that between 2003 and 2012, diagnoses for depression and anxiety among children 6 to 17 have increased from 5.4% to 8.4%. This increase does not even offer insight on adolescents suffering during the COVID-19 pandemic, adolescents who have not been diagnosed, and adolescents with anxiety or behavior disorders that subsequently result in depression. Should these numbers be included, it is certain that the rates will be even more dramatic. So again, why is this important? Clearly, the amount of American teenagers having been diagnosed with depression is too high, and the statistics are only getting worse with each passing year. Treatment is a crucial step if we are to make these numbers lower. Our team question is this: what are solutions to help combat depression in American teens? When exploring this question, we are not simply seeking any solution. Rather, we are seeking the most preferable solutions. Preferable comes off vague, but we will elaborate on that as we present our findings. We have boiled our potential solutions down to two. I'll let Samantha take the stage now by presenting our first solution.
So our first solution is using only psychotherapies. Here are some definitions that will help you understand what we're talking about. Psychotherapy. Psychotherapy is a personal interaction with a therapist to help a person change behavior and overcome problems in a desired way. CBT, which stands for Cognitive Behavioral Therapy, which focuses on emotional regulation and coping strategies. IPT, which stands for Interpersonal Therapy, which focuses on the improvement of social skills. So here are the benefits of psychotherapies. Potential. Psychotherapy still has room for improvement without the risks that come with antidepressants. Certain antidepressants, such as ketamine, pose a risk of addiction which can further worsen an adolescent's health. So psychotherapies have no risk if a patient tries it out. Stigma. Reports show that psychotherapies provide effective care in a less stigmatized setting. Compared to taking medication, receiving therapy is less shameful in the eyes of society because antidepressants are associated with drugs. So psychotherapies are better for patients who think about the opinions of others. Well-being. Psychotherapy is better for patients dealing with cognitive, interpersonal, and emotional instability. So if a patient is struggling with mood swings, social anxiety, and overwhelming thoughts, psychotherapy such as CBT and IPT is more fit to help them cope and regulate their anxieties. Effectiveness. Adolescents with subclinical depressive symptoms have a 63% lower risk of having a depressive disorder follow-up. In other words, if teens who have moderate depression and symptoms receive therapy treatment before their condition becomes severe, then they have a lower chance of relapsing into another depressive order.
Another solution we decided to address this problem is the combination of both antidepressants and psychotherapies. From the previous slide, Samantha has briefly mentioned about the risk of antidepressants. Before we go into details, let's define what antidepressants are. Antidepressants are medicines specifically used for treating major depressive disorder and some anxiety disorders. SSRS is a class of medications called serotonin reuptake inhibitors and increases amount of serotonin, which is happiness. These kind of medications also help in treating depression. And one example of this is fluoxetine, which is a commonly used SSRS medication. So what are the benefits when patients receive a combination of antidepressants and psychotherapy treatments? Based on our research, statistics have shown the reduction of antidepressants prescriptions, which led to higher rates of suicide attempts as patients relied mostly on psychotherapy. In other words, limiting the use of antidepressants have a negative impact on patients as they are likely to have suicidal thoughts and only have a choice to rely on therapy for treatment. This is why we decided to add antidepressants to the solution, since it shows potential in reducing depressive symptoms. Since having antidepressants available to patients is a benefit. Next is efficacy. Fluoxetine in combination with CBT, which stands for cognitive behavioral therapy, is best choice for acute treatment of moderate to severe depression. Since fluoxetine and CBT are examples of antidepressants and psychotherapy respectively, this information confirms our solution of having the combination, which results in improvement of reducing symptoms for depression. Therefore, patients will have a higher sense of efficacy and willing to take treatments that benefits them. Having this combination relates to choice, which provides flexibility between antidepressants and psychotherapies. It is morally right for patients to be given a variety of treatments that are potentially effective. They shouldn't feel trapped in sticking to one specific kind as it may wear off its effectiveness. Lastly, this solution shows acceptability according to our findings. Given personalized treatment from the combination, patients express commitment in continuing to take the treatments. Our research shows evidence in the reduction in depression when given the right treatment from the combination.
You may be wondering why these solutions are selected at best. What makes other solutions flawed? As explained, our solutions, we have stated, are selected at best because it has shown positive results through its effectiveness in treating depression for teens. Solutions such as comfort food, painkillers, and shopping are commonly used by teens. These solutions are flawed since they can't actually treat depression. It may relieve depression temporarily, but it will cause more problems in the long run. Relying on comfort food to treat depression can cause health problems such as obesity and increased chance of getting cancer. Painkillers are used to alleviate pain, but they are used to numb emotion. But if they are used to numb emotional pain, then that becomes a problem. In other words, painkillers are not specifically made to treat depression, and taking the wrong medication will make their symptoms even worse. Doing something fun like shopping can temporarily relieve depression, but shopping too much may get the person into debt, which stacks another problem as a result of relieving depression. Although these solutions have shown benefits from patients, we would like to address some limitations to them. For the combination solution, limitations include the fact that increasing antidepressant prescriptions are related to more youth suicide completions, and that time and money and progress in recovery may be wasted. In some cases, we find through our research that antidepressants and psychotherapies may not be helpful for every individual, which is why it may be a waste. Antidepressants will help treat depression, but they can also give severely suicidal patients a way to kill themselves. The solution for only psychotherapies include limitations such as the fact that psychotherapies usually work best for mild to moderate depression. Prices for treatment depend on how severe the depression is, and that counselors and psychologists can be overwhelmed. Because therapists listen to patients with their depressive problems, they may feel exhausted, which might not give other patients a good experience in treatment. Based on all of our research, we have concluded that the best solutions to help combat depression in American teens are psychotherapies alone or the combination of both antidepressants and psychotherapies.
Here's a
And
of our works cited page. Okay, thank you.
Okay, guys. Can you hear me okay?
Yeah.
Yes.
Okay. Thank you very much. Let's go ahead and move to our oral defense questions here. Okay, and let's go. I'm going to start with how I see it on the screen, which is going to be Christine, Jason, Samantha, Kenneth. Okay, so Christine, we will start with you. How did the group decide to include Jason's perspectives or lens or conclusion into the overall presentation?
As we were arranging the slides and like figuring out what lens fits with what kind of like title, then we found out that Jason's slide fits for the limitations because not all patients can afford such antidepressants or afford for psychotherapy appointments. So we find that with the the patient's income, then maybe the economic lens should serve as a limitation because, you know, person's income, like not all incomes can like pay the prices for such treatments.
Okay, very good. Thank you. Jason, give one specific way that your thinking changed as a result of learning
You just
about.
disconnected.
Okay. All right. Kenneth,
Yep.
let's go. Well, now you're on my screen right here. So give one specific way that your thinking changed as a result of learning about Samantha's findings.
All right. Well, what I realized is that a lot of what I was finding when I was working with the ethical lens was that even though Samantha was doing scientific, I actually ended up finding a lot of scientific sources as well. And what I did was I actually used those scientific sources in a way that would spin it in an ethical sense. So along the way, I often asked Samantha every now and then if she had any data or anything like that that I could add on to my ethical lens. In the end, I didn't add too much, but a lot of it I kept in mind, which played a big impact on my reasoning.
Okay, thank you. Samantha, reflecting on any of your colleagues' work, which one had the greatest impact on your overall understanding of the problem that your group identified?
I would say it would be between Christine's and Kenneth's lens which would be society and ethical, because the thing is with antidepressants and depression, there's a lot of stigma and opinions about how it should be viewed, especially in adolescence and their health. So we really took in consideration what parents think, the uh, teens think, and what other people think. So that really played a role in our solutions.
Okay. And then let's give Jason just maybe 5 seconds to see if he comes back in. If not, we will wrap it up. Let's see here. All right, we may not be getting Jason back. Maybe who can, we'll troubleshoot that later. I'm gonna stop in here in a second.
Oh wait, he's in the waiting
Oh,
room.
there he is. All right. We'll go quick once he gets in. Jay, can you hear me? Jason, can you hear me, bud? Because we're gonna ask you a question here real quick if you can hear me. Hello? You gotta unmute if you can hear me. Okay. All right, let's try. Okay. Okay, we're gonna try here. Which of your colleagues had the greatest impact on your overall understanding of the problem your group identified? If you type it in the chat, maybe we'll have one of your one of your teammates read it. We'll try to use that maybe as a yes. Which of your colleagues or teammates had the greatest impact on your overall understanding of the problem your group identified?
Um,
I'm typing it into the chat. Oh, you know what? Oh, there you is. You're there. Oh, he's not there. I'm trying to type it. It's not taking him. All right, we're gonna wrap this up here and we're gonna move on. Hold on one second. There we go.